I had my ticket out. I was ready to go, and some guy in front of me was fumbling for his ticket. And this was way before the TSA stuff. And so the guy motions me forward to come on and tear my ticket. And so he says, "You have a very nice flight tonight." And I was already starting down the ramp, and I looked at him and I said, "Thank you." And I see his name on his name tag, and it says Ed Lundblad. And I'm dazed walking the rest of the way down the ramp. And I get on the plane and I look at the flight attendant and I said, "A guy there, his name tag says Ed Lundblad." And I said, "Is that Dr. Ed Lundblad?" And she goes, "What?" And I said, "It said Ed Lundblad." She said, "Yeah, that's Ed." And I said, "Could you check if you have time?" And she said, "Oh, yeah." So she comes back halfway into the flight and she said, "Yeah, I couldn't call him at the podium, but I called the desk and they said he's some retired Army dude."
And you knew him.
Oh, yeah. So I came back on Midway Airlines a few days later. I am on a hunt. I am on a mission.
And so tell us why.
Okay.
Good afternoon. Today is Friday, the 14th of February, 2025. I am Suzanne, and I am interviewing Kyle Liston today at the Rocky Mountain Regional VA Medical Center in Aurora, Colorado, as part of the VA's Remembering Our Veterans program. So, good afternoon, Kyle. How are you?
I'm good. Thank
Good.
you for asking.
Good.
Thank you for having me.
Oh, you're quite welcome. It's a pleasure. Tell me a little bit about your childhood, where you were born, where you went to school, kind of the early childhood part.
Well, I was born at North Carolina Memorial Hospital, which is part of University of North Carolina in Chapel Hill. And I grew up in the Research Triangle Park, which is Durham, Raleigh, and Chapel Hill. Went to school in a little neighborhood, Parkwood Elementary. And when I was older, they had just built a junior high school for us.
Oh, wow.
So it was brand new. It was Lowe's Grove Junior High School, and it was actually run by a colonel who had retired from the Army when we were first there. And I grew up around a lot of really intelligent children, and they were sons and daughters of extremely intelligent people. Almost everyone's mother or father had a PhD or an MD, or they were a judge or an attorney. We had the highest per capita PhDs in the country there. So it was a very interesting place to grow up, just to say the least.
So did you feel like you belonged in that group? Because you kind of said in a very, they were also well-educated from well-educated parents.
Yeah, they grouped us by our abilities back then. So all of the kids who were more educated and more talented were grouped together, and I was part of that group. I was not at the head of that group by any means, but I was definitely part of that. And it worked out well, except for when I got into, I believe it was the 8th or 9th grade, I decided not to play band. I was playing the trumpet in the band with braces on, so that wasn't working for me very well. So that was the year that I dropped band, and I was placed in the regular science class, and there were a lot of people cheating off of my papers, and the science teacher noticed what was going on. So he told me to come in during his free period, and he taught science to me while I was helping him grade papers and that sort of thing. But a couple of things that I can tell you about my very first years. I was born exactly 1 week from the day that JF Kennedy was shot and killed.
Okay.
And my mother was holding me, and the neighbor was over, and my mother called the neighbor and said, "Come and watch TV. Somebody just shot the president. The president is dead." So that was a really big moment in history, and something that I was always wanting to read about, learn about, watch all the documentaries about it, etc. And my father related a story to me. he was holding me when I was approximately 3 weeks old, and he said that we had this moment of telecommunication, and he said that he was looking deeply into my eyes, and I was asking him the existential question, what in the hell are we all doing here? He said, and he was trying to communicate with me why I was back on this earth. And another actual memory that I have, my maternal grandmother, she died when I was 3 years old, and she had colon cancer. But I remember her taking care of me. I remember her washing my hair. I do remember trips to my grandmother's home. She lived about 3 hours away in Charlotte. And we didn't have a bathroom. She had an outhouse. It was a very poor house that she was living in. And my mother would go and take care of her on the weekends. And my Aunt Libby, who was on my mother's side of the family, she would come and get me, and she would take care of me. And my Aunt Libby and Uncle Benjamin never were able to have children. And Aunt Libby treated me like a second mother. She treated me like I was her own child. And several years later, she was able to adopt one child, a little girl named Deanne, and her wishes were finally fulfilled. But I just remember how much she loved me and how much she took care of me and how much, love that we shared together. And her husband, my Uncle Benjamin, he and I were very close as well. But I do remember being in the kitchen shortly after my grandmother died, and somehow suddenly understanding the finite point of when somebody is dead, that they're not going to come back, and that she was no longer with me and she was no longer in my life. And I actually really mourned her when I was that young.
Wow.
So that was pretty significant.
That's
in my
very
life.
significant. Now, what about brothers and sisters and cousins and like that? Do you have any
Oh, yeah.
family where you grew up close to you?
Sure. My older sister was 6 years older than I am. And they had a baby, my sister, right after my father graduated with his PhD in chemistry from UNC. And it was a time that they probably would not have chosen to have a baby because he was so new in his career, and he wanted to take care of his family financially. And my mother did end up working at the VA in radiology. She was a federal employee all of her working life, actually. So she was working in radiology, and he was working as a chemist at that point in time. So another really strong memory that I have, when I was growing up, I had 4 best friends. We were all living on the same circle together. And one of them is Dr. Aman Sandhu. And she and her family were from India. And when she was 6 years old, she was playing kind of a merry-go-round game with my sister. And I should have prefaced this. She had polio when she was a baby and living in India. And she had a left leg that was much shorter than her right. So they were playing merry-go-round, and the whole we all fall down, she fell down, and she actually broke her hip. And she was in a full body cast and then a half body cast for a total of nearly 2 years. And I was the only friend that would come and visit her. And her parents really took care of me. Her father was very, very smart. He worked for the EPA. He was a Democrat, which fortunately I was exposed to several children's parents that were also Democrats. But he really loved Aman and treated her more like a son than a daughter. And instead of fights, he would engage the children in debates and try to draw out our intelligence and our ability to talk calmly and productively about a certain subject that we both were into and interested in. So I also got to eat plenty of yummy Indian food when I was younger, and became accustomed to that. And she had a tree house that her father had built for her after she had broken that hip. And we spent a lot of time in the tree house together. And I guess, my other best friend, Kiri, her mother was a nurse. And when I had to take allergy shots, her mother gave me the shots. She was a nurse anesthetist, and she had worked for William, trying to think of the last name, William Masters. She was the nurse anesthetist for him. And that was just very interesting growing up near her as well.
And so did you go from elementary school through high school in the same area?
Yes. So once we finished junior high school, we went into high school, and we were merged with another junior high school, well, two other junior high school's kids. But backing up a little bit to junior high school, I was put in the French class. And that was the first time I was exposed, except for passively learning some Hindu and some Punjabi language. I was placed in the French class, and just the whole idea of it was very intriguing, to learn a whole new language. And I was fascinated by it. And I just got really drawn into learning that language. And French is the language of love. And I was everybody's babysitter since I was 10 years old. And I ended up babysitting for the pastor of the church. And so whenever there was a big event, I was everybody's babysitter, and everybody's bringing their kids over to the pastor's house. So I would earn a lot of babysitting money. And the very first year, I wanted to go to France. And my parents said, well, you can go to France, but we don't have the money to send you. So I saved up all my babysitting money, and I went to France for the first time. And it was absolutely awesome. I loved it, every bit of it. I feel like I was probably French in former lifetimes, which I actually do believe in. I'm a crazy vet, which Suzanne's going to find out.
You were in high school when this happened, or right
after high school? I
was
in junior high school.
When you went to France?
I was about 13 years old the
and
first time.
And who did you go with?
I went with a few of my classmates, including Laura Nixon, who was the French teacher's daughter. And I'm thinking Kelly Kokenauer was the girl that I shared the room with. And our first place that we went to was, I think it was Chamonix, where they raise the horses. And they raced the horses there. And we were staying in an old castle there. And we did castle tours, we did river tours. They didn't care what we drank. So, every night when we went to dinner, there's a bottle of red wine and a bottle of, it was really a carafe of wines on the tables. We went to the G.H. Mum factory. They had us drinking champagne, and they were telling us vite, 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 which was fast, fast, fast. And they were handing us more champagne to down. So, here's these kids who haven't been exposed to alcohol yet. They're getting us pretty drunk, which was funny. But I loved it so much that I saved money for a second trip to France. And that time we went to England. And we saw the play Little Orphan Annie.
Wow.
And by that point in time, Rocky Horror Picture Show had come out. And Tim Curry, in Rocky Horror Picture Show, the play was actually still playing in London. And I did not want to go see Little Orphan Annie. And years later, I remember the teachers getting us hopelessly lost in the streets of London. But years later, I was watching the movie Little Orphan Annie. And I remember Tim Curry chasing her up the bridge, and then I walked out of the theater with making up my own special ending to that. So that was interesting.
So now, did any of these things, all these adventures and living where you live with all these highly educated people, did that have any influence of your joining the service? And if so, what was it? And
not quite. What ended up happening was when I was 17, I was in high school, I was skipping a lot of high school, either 10 or 20 days per grading period. And we had this whole system worked up where if you missed a math class and you missed a pop quiz or turning in a homework assignment, the teacher would ask us for a random homework assignment to see if we were doing our homework. If you missed that, you had to go and work on the school computer, which was a whole room. That was the size of the computers then. And you could do a computer 20-question worksheet and turn that in instead. So we would go to my friend Robin's house, and I would do 3 math quizzes, and she would do the English homework, and our friend Steve would do the history homework. And then we would go off. Steve would go to his house. Robin and I would go to Cary and see our boyfriends, or we'd go to Duke Gardens or the Raleigh Little Theater to the Rose Gardens, or we'd go to the mall. But then when our report cards came out, the parents would look at it and they're like, oh, you got an A in this and a B in this and all this, and your GPA is really good, but it says you missed 10 days of school. How did you miss 10 days of school? I said, well, they've got the new computer at school. They're having a problem with decimal. And so I just kind of cheated my way out of that. So that was kind of how 11th grade went. I wasn't close to very many people when I was in high school because I didn't show up. Ultimately, I ended up with my parents moving to Alabama just before what would have been my senior year in high school.
Wow, that must have been devastating.
It was devastating. So at that point, I had advanced enough in my French that I was tutoring a couple of students in French. And then if the teacher called in, I was actually teaching the class for French 1 and French 2. I was at a level of French 4 and wanted to go into French 5 the next year. So I go down to Alabama. I'm on a house hunting trip with my parents, and we went to the Decatur High School. It was ridiculous down there. So those classrooms were still segregated. So you walk through the halls, you saw a white classroom with a token black student in it. You saw a black classroom with a token white student in it. I went to the front desk and I was let into the office. I can't remember if my parents were with me or if it was the person giving me the school tour. So there was a little girl who was black, and she was pale and she was curled up on the floor with menstrual cramps, and she was begging the woman at the desk to call her mother. And I was feeling very sorry for her, and I had painful menses at the time, and I could relate to her. And then this white girl comes up to the window at the desk and says, I'm not feeling well, could you call my mom for me, please? And she says, certainly. So she picks up the phone and she calls this little white girl's mom. And this white girl did not look the least bit uncomfortable, distressed, or like she had anything wrong, like a cold or anything with her. And so the disparity of that, and accompanied by the fact that they wanted me to take 3 credits of PE and 3 credits of Alabama history, and I could take French 2, or I could take the English class that I had already had and read the same books, I was refusing to go to school there. So I actually applied for a fellowship at what was then called Atlantic Christian College, and they ended up paying for half of my expenses, tuition, books, and fees. And my dad told me, he said, if you can get into a school that's going to pay for half your expenses, he said, I'll let you go. So my parents went with me to the school, did the interview, et cetera, et cetera. And I got into that school, no problem. And about 4 or 5 months into the school, I was on the phone with my parents, and my dad got on the phone with me. And I said, well, Dad, I think I know why they let me go to this school and gave me this fellowship. And he said, yeah, your GPA was good, you interviewed well, you were assigned to the French teacher to help her with the classes, and her grading, et cetera, you really fit well. And I said, no, Dad, this is a special school. And he said, well, what do you mean? And I said, well, it's a special school. And he kept asking me, and that's what I kept repeating. And I said, I don't want to use the word, but, they're retarded. And he said, Kyle, 50% of the people in this world have an IQ below 100. And we had already had our IQ test done. And I stopped, and it was like, that can't be true. And then the next thought was, oh my God, he's right. And I realized that for the first time in my life, I was integrated with people who were not as intelligent. My father had a photogenic memory, a photographic memory. And I actually thought, honestly, that people grew up and went to college and became that intelligent. And my aunt, who did the IQ testing on both of us, she would never tell my dad what his IQ was because it was so freaking high. And so, that was my first exposure to normal average IQs. And I didn't feel like I fit in there at all. I didn't have very many friends there. And I definitely wanted to leave after that last year.
So is that what made you decide to join the service, or what did
No.
make you decide?
So after that, my parents bribed me with a car to come down and go to school at the University of Alabama in Huntsville. So I was there for 3 years. They had a really good nursing program that was one of the highest rated in the country. They had built new dorms, which were actually apartments. That I was on the 3rd floor, so it was a walk up. We had 3 bedrooms with 2 captain beds in each, and we had a common kitchen and a common living room and 2 showers and restrooms. So that's what we lived in. And the old student housing were townhomes that were decrepit and really run down. So I was there. The second day I was there, I met my college fiance, and we were together off and on with this crazy relationship for that whole 3 years that I was there. And let's see, what else did I want to say about that? So I took a job as a ward secretary my first year in nursing school. And the woman that I was working with almost stroked out one day because the job was so stressful. And it was too stressful for me, and I quit. I had learned to be both a pastry chef and a cake decorator. When I was younger, I got into cooking, and I would bake cakes for people, and I would decorate those. I actually made my sister's, red velvet cake for her wedding, and I decorated it. And, I would do everybody's birthday cakes and special orders for people at church. So I was definitely into that. So I got hired at Albertsons to do specialty cakes, and that's what I did for a while to finish out my summer. I got a repetitive motion injury in my arm because of squeezing that icing bag too much. Mm-hmm. So then I got hired by a local hospital, Crestwood, and they were paying me $3.50 an hour. And what they were doing was they split the ward up so that an RN and a paraprofessional would take one side of the hall, and they would put the nursing student on the other side of the hall. So the job of the nursing student was to do all the job of the RN and the paraprofessional, which would be the nurse's aide or the certified nursing assistant, CNA. And we could do everything except for hang blood. So we followed the doctors around, and back then the doctors were used to being catered to, and this was the Deep South, it was Alabama. So we were carrying their charts, handing them our own stethoscope, being very subservient, which is something that Suzanne knows I am not. And so, it was a horrible job just because of the workload and the stress that came with it. And when I graduated from nursing school, they were offering me $8.65 an hour, which is an absurdly low pay wage for an RN. And I had experience going straight into nursing with everything except for hanging blood, which is pretty easy, but you have to do all your checks and everything has to be correct before you can hang the blood. So I started being courted by the Air Force and the Army recruiters. And I honestly, like another friend of ours who volunteers here at the VA, I honestly joined the Army to get out of Alabama. I wanted to go anywhere but Alabama and be a nurse. So I really felt good about becoming an Army nurse. And
why Army nurse?
Well, the Air Force recruiter was just painting too rosy of a picture of what Air Force life was going to be.
Okay.
And I didn't like him and I didn't trust him. The Army recruiter was being more clear. They both had a program for OBGYN nurse practitioners at the time. And 2 days before I joined the Army and I graduated and had the pinning ceremony at the same time, they reduced the nurse practitioner tract and made it a clinical nurse specialist tract. However, they did not change the program at all. So the program was oriented towards nurse practitioner. And so we got everything except for prescriptive authority, meaning that we could not write prescriptions for our patients. So we had to be able to do speculum exams. We had to be able to do internal pelvimetry, which is measuring the pelvis. We had to make sure that the baby's heads were fitting properly in the pelvis. We had to do everything to get the baby to deliver. During my junior and senior year, we were able to choose our specialty areas, and I chose OBGYN. They did do saline abortions back then, and the hospital that I did my fellowship in, they did do the saline abortions, and they also delivered, and they also did epidural anesthesia. So I got very accustomed to running Pitocin, running magnesium sulfate for preeclamptic patients, and I assisted with the saline abortions. That was something I never actually wanted to do. I am definitely a pro-choice person, and I advocate for people's reproductive rights. And I believe that women should have a choice, but I personally never wanted to contribute to aborting babies. That's just a personal choice, but I supported it and was involved with that.
And so this was all before you
Before
were in the
joining
Army?
the Army. So my
So you had a lot
nursing
of experience.
Right, my nursing, and I jumped on every experience I could possibly have. I actually was in the OR one time for a woman who had to have open heart surgery. And she was very apprehensive the night before. And they tell you apprehension is the worst emotion that you can see when you're in the hospital, that if someone is very apprehensive, someone is in danger and there could be a problem. Well, she died on the table. And the doctor was freaking out, the surgeon was freaking out, and the anesthesiologist, he was asking me, go get this, go get that, et cetera, et cetera. And I ran room to room, and I was getting supplies and getting machines, and they put her on a bypass machine and an aortic pump machine. And at the end of this, he said, what year of medical school are you in? And I'm like, I'm just a nursing student. So, it was a lot of intense exposure for me. And then I did go into the Army. I was very fortunate. One of my classmates' husbands was stationed at Redstone Arsenal in Alabama. And he was probably an E7 or E8 at the time. And he was career Army. And he gave me the lecture of don't be a butter bar. A butter bar is a second lieutenant and is an officer. And a lot of them, because they're, junior officers straight out of school with no military experience. They want to throw their weight around, especially with enlisted people, because that's the only population that they outrank. So he was definitely trying to steer me in your enlisted people are the most important people for you. Treat them well. They will treat you well. End of story kind of thing. So I went into the Army with that in mind. So I was sent to Fort Sam Houston for basic training.
And how old were you at that time?
I was 21 years old.
Okay.
Because I had skipped that last year of school. Mm-hmm. And, just full of ambition. Also, I was just a prankster. Mm-hmm. And, one of the crazy things I did was we were all coming back in our BDUs, our fatigues from classes, and everybody was around the pool. We actually stayed in a hotel for our basic, and other than getting awoken at 4 o'clock in the morning to go run and do PT, go to class, we would hang out by the pool. We would go to dinner at night. We were on the Riverwalk in San Antonio. Oh, wow. It was beautiful. Mm-hmm. It was magical. It was a wonderful place to be. And so one time we're all in our BDUs, and I'm like, let's jump in the pool. And everybody followed me, and everybody's jumping in the pool in their full battle dress uniforms. And one of the guys who was a platoon leader, he was a nurse anesthetist, and he was so straight-laced and so tight. He was tense all the time. And he needed to unwrap and just be calm and just be part of the group. Well, his name was Michael, and his birthday was coming up. And I wanted to do something really special and really memorable for him. So I went to the major, who was over our whole training. She wasn't our TAC officer, but she was over our training and over the TAC officer. And I asked her if I could do something with a little bit of a joke for his birthday. It was Captain Moore. And she said yes. So I called everybody into what was a quadrangle. The buildings were, 4 buildings surrounding a courtyard. So she let me call everybody to the quadrangle. And they didn't know what was going to happen. They just knew that they were there for some reason, that the major was wanting to speak to us. So we're all there gathered around, and all of a sudden this Mideastern music starts. And this belly dancer comes down the stairs, and she's dancing and moving and grooving to this. So she comes up right in his face, and she's shaking the belly dance suit and all this stuff right in his face. I don't think I've ever seen a shade of red that was darker and more shiny than Captain Moore's face. And let's see. We went into Mexico a couple of times. We went to the beach. I was bonded to 3 different people that were just my best battle buddies. It only rained one time when we were in San Antonio, and it pretty much flooded. And I remember, like 8 inches of rain, and we were outside. I don't remember if I was in my BDUs or in my civilian clothes, but we were out there just as happy as we could be because we got rain, and our shoes were soaking wet, and our clothes were soaking wet, and the hair, everything. And we were just laughing and having a great time. But the other thing that happened to me in basic training, they separated us by size. So the short people were all in the same platoon, and the very shortest, which included me, we were in the same squad. So we went out, we were on a field training exercise, FTX, and they sent us on a compass course. But for some reason, they chose for us to be out between 12 and 2. And it was a 7-mile compass course. And in San Antonio, in the desert, there's not much shade at all. And when you're on the compass course, you have to stay in a direct line when you're reading the compass so that you arrive at your next destination. And so before we even took off, they gave us a canteen of water. They made us drink it all. Then at every stop, they made us drink another canteen of water. So at the time I entered into basic training, I weighed 95 pounds. And the running and all that stuff and the way that they fed us breakfast, I gained a few pounds, but not that much by then. So with my weight, they gave me 7.5 liters of fluid in a 2 to 3 hour amount of time.
Too much.
Right. So what happened was I was the only one who had to go out and relieve my bladder the whole time. And when I came back, my skin was lobster red. I was giddy because I was having a heat stroke, and a very serious one. So I wasn't sweating anymore. And I was like, hey guys, look, I look just like a lobster and I'm not even sweating anymore. And we were about a mile out from our last stop, which was the tent that we were going to go into. And Mike Moore, the captain, the anesthesiologist or anesthetist, he said, give me your rucksack, give me your weapon, give me your outer shirt. Do you think you can make it a mile? And I was like, yeah, I can do anything, because I'm giddy from the heat stroke. So we get back to the big tent, and I absolutely crashed on one of the cots. And they never took my temperature. They sent me by ambulance to the Army Medical Center. And once I got there, the nurse asked me for a urine sample, and I got a urine sample, and I gave it to her. And she dipped it, and she said, did you put water in this? I mean, just like that. She accused me of putting water in the urine cup, and I said, no. And she's like, well, I'm not getting any electrolytes in it. So my electrolytes were so diluted, and then further diluted by the fact that they gave me another 2.5 liters of D5 half normal saline. So it was half of the amount of sodium that you would carry in your normal bloodstream. So they made me worse. So I was never given a blood test for the electrolytes, and I was sent back to the hotel. I think the TAC officer drove me back to the hotel, and I was just put on quarters to rest. And in the morning, I get up, and I've got my brown shirt, and it's white, and I pick it up and shook it, and all these electrolytes that had been in my body shook right out of that brown shirt. So I was very ill, and I made a slurry out of Tang and drank that, and drank orange juice and ate bananas all the time, because I actually got so sick I had ticking of the muscles in my jaw. And that was the only injury that was never well documented at all when I was in the Army. So,
and that was during basic training?
It was during basic training. And at first, somebody thought I was malingering, which is not good. But then we had like 7 or 8 other young lieutenants who were around my size. They dropped too. And then it became a command issue, because they were not responsible enough to let us do the compass course at a reasonable time for people who, didn't weigh much, and they shouldn't have been forcing us to drink that much water. It was not the correct amount for our weights. So they got in trouble, and I was not in trouble. But I was released back to the FTX, and I did qualify with the M16, and I qualified with the Colt 45, which were the officers' weapons that we were supposed to be able to use. So the FTX was finished. The rest of basic went really well. I enjoyed my time there. Our accommodations were wonderful. I stayed in touch with my friends for a while. One of them was stationed here with me. But let's see, my first assignment was to Fort Bragg. Part of the time I was working on a male ortho floor, and that was a good time. And the rest of the time I did my OBGYN clinical nurse specialist course that was held there. And there were only about 9 or 10 of us in that class, and there were 2 majors who were our supervisors and our teachers. And I learned a lot from those classes. And we had the didactic portion, then the hands-on portion. They were kind of integrated. We did a little bit of both. We did some care of the newborn, but everything was just very hands-on, very technical. I absorbed everything that was taught there.
Sounds like you really enjoyed that. Was that one of
I
your
did.
favorite assignments?
It was.
How long did that last?
It was 9 months.
9 months,
believe.
and then where did you go?
Well, let me finish this. So
Okay.
I remember being there, and somebody had turned on a TV, and that's when the space shuttle was launched that Krista McAuliffe was on, the teacher was on, and it blew up.
I remember that day.
And my mother was working at NASA in Huntsville, Alabama that day, and she and her boss, they were the last ones to sign off the astronauts before they were launched in the shuttle. That was what her job was literally to make sure all the I's were dotted and all the T's were crossed. So that was her thing. And, I just remember how devastated they were when the shuttle, blew up, essentially. But I just remember being in that room and all eyes were fixed on that launch and the disaster that it was. So I do remember that from that period. And then we all got our orders cut, and 2 of us went to Fitzsimmons.
Oh,
and
that's where Fitzsimmons comes in.
I did remember one other thing from basic, and this was weird. So we had that pool, I believe it was on the first level, and then on the second level, we had a Coke machine, and we would have these parties over the weekend, and we would drink. We would get beers and wine coolers and snacks, all this stuff. And there was a guy, we all would scale up the Coke machine and go up the balcony, go over the balcony and into the party room. Well, there was this guy named Tom, and every time Tom came to the party, I don't know why, but I hated him. I did not want anything to do with him, and I would literally peel his fingers off the balcony, dump him down on the ground floor. And I'm usually not a mean person like that. So he left basic, and he was stationed here at Fitzsimmons Army Medical Center in Colorado. And the nurses who worked with him also didn't like him. Well, it took about a year, and he admitted to a civilian nurse who was married to an Army nurse that I worked with and who had been in my basic class that I really loved. Tom admitted that he liked giving little boys baths. And it turned out that he was a pediatric nurse who was molesting little kids. And that's when I realized I hated him because he was messing with little kids. He was a pedophile. And I didn't know why, but my instincts was he's a bad person. I don't want to mess with him at all. I want him out of my way.
Wow. And so did you run into him at Fitzsimmons, or was he there?
A few times, yeah. Just because, occasionally we'd get called to work on peds, and we were trained in pediatrics too through nursing school, and peds was a good place for me to be.
And so that was your second assignment?
Yeah, so basic at Fort Sam Houston and Fort Bragg for male ortho. They taught me how to put in IVs. The anesthesiologist taught me how to be a one-stick wonder, which means somebody who can stick one time and get that IV in, no problem. So, I had the OB-GYN class there. And then I was stationed here in Colorado at Fitzsimmons.
And how was Colorado for you? How was Fitzsimmons?
Hmm.
There's a big medical center, so
So
should have been nice.
So that was back when the hospital was in Building 500. Mm-hmm. And I had to drive cross country to get here. And I was in this little Plymouth Champ. That was my car. And I got bronchitis or pneumonia or something when I was traveling cross country. So I had my little bottle of Robitussin and my Tylenol and my bottles of water. and I'd get to my next city, and I would take towels and shove it, under the door and turn the shower on until the room got steamy. And finally arrived here on June the 12th. And I'm trying to remember what year that would have been. It would have been 1986 in June. And when I arrived in Colorado, it had just rained. We always had rainstorms in the afternoon then. We don't have that anymore because of climate change. But it had just rained, and there was this huge double rainbow in the sky. And I got out and I took pictures of it, because I had just crossed through Kansas and I was coming in. It was just beautiful. And to me, that was a sign that I was in the right place. And then once I got there and checked into the barracks, because my apartment wasn't ready for more than a month, my favorite uncle, David, called me to let me know that my cousin Catherine had been born that day. And he had done Reiki on her. And I have a Reiki story if we end up having time.
And so you have to explain what Reiki is.
Reiki, there's a lot to it. It's an energetic system of laying on of hands that used to be passed down through the Christian religions. And that was something that a Japanese professor was asked by his students, do you know how to heal with your hands? That was about 150 years ago. And he said, I don't know, but I'll find out. And he went through all these different churches and, ended up going and fasting and living on a mountain for 40 days, just like Jesus did. And finally, on the 40th day, he woke up and he saw these symbols in the air, these ancient Chinese, Japanese symbols. And Chinese and Japanese written language is almost the same. And that was Yusui, I'll think of his name in a minute. But he was very gifted. He came down the mountain, and this little girl who had broken her elbow, he treated her with the Reiki energy. And her elbow was healed, and her family brought him in and fed him and gave him water and took care of him. But yeah, there's a lot more to that.
So your
my
uncle did it on his
this
newborn.
on my aunt when she was in labor.
Oh, on your aunt.
And this was her second child. And her first labor was awful, and the delivery was just really awful for her. And so this baby, Catherine, was born very, very gently. And she didn't have any pain until she was crowning with the baby, on the perineum. And so, Catherine's birth was just very, very easy. And my aunt just didn't feel much pain at all. But I remember David calling me at the barracks and telling me that my cousin was just born. And then the next thing that happened was they had this group at Fitzsimmons that was an adventure club. And we used to have a place at Fitzsimmons where you could go and rent skis and rent camping equipment, anything you wanted to rent for next to nothing. And so I went there, rented a tent and rented a sleeping bag and went on a camping adventure. And we went to Telluride, and we were climbing mountains and panning for gold, which was really fun because I got just enough gold to put in one of those little capsule bottles and to send to my cousin Matthew, who was Catherine's older brother. And so I sent that to him, and we took a lot of pictures, and it was really a fun experience. And when I signed in, I wasn't due to start working yet. So I got to play and I got to see Colorado. And there was a woman who was here. She was a reservist. And I was living in a women's barracks situation here on campus. And she said, okay, ladies, let's go meet some pilots. And we're like, what? And she said, I'll show you how. And we're like, oh, okay. So she picks up the phone and she calls over to Lowry Air Base, because Lowry was big and flourishing back then. And she says, I have a group of officers that want some aerial familiarization with Colorado. do you have anybody who needs some flight time? And of course, they speak up right away. And they're like, yeah, we can show you ladies around. Just wear your BDUs and bring your ID card with you, and we're happy to take you up. So we did this a couple of times. We went over to Lowry, and we had these helicopter pilots take us up. We had the earphones and all that kind of stuff.
Wow.
It was fun. And, you know, we started familiarizing ourselves with Denver and driving around Colfax and downtown, and just really getting to know our surroundings, and really enjoyed that.
And so, any other highlights of being here at Fitzsimmons?
Most of what I did, I truly enjoyed, both at Fort Bragg and here at Fitzsimmons. I would say definitely more at Fort Bragg. But being a single woman, there were so many men to date. And, you know, at Fort Bragg, if you were a woman and you were already dating somebody and somebody else asked you out and you were interested, you just said, I'm already dating somebody. Is that okay with you? And if they said yes, then I was dating 4 guys at the same time, and it was fun. And one of the guys, his father was a 2-star general. And so when we went out to brunch together at one of the officers' clubs, we parked in the general's parking space. We were at the general's table. We're overlooking the water. I was the only girl that he ever brought home. I went to Pawleys Island with them. I just had a blast. And here at Fitz, I dated a few different people and really enjoyed that.
And then what happened after Fitzsimmons?
Well,
or during Fitzsimmons?
Yeah. So I need to bring in the serious stuff. So my first husband.
When did you get married?
Well, I need to share this. So I had met a man in Basic, Bobby, who I was very much in love with. And he and I traveled back and forth. He lived in Texas, and he was a reservist. But we would travel back and forth and see each other. And we had broken up. And I was just devastated. And I remember, running a lot after that point in time. And I had a running injury to my low back and my left hip. And I had gone on sick call for 2 weeks in a row. I would show up and I would tell them I needed to go on sick call because my back was in so much spasm and I had pain going down the left leg. And so I would check in and they would send me home, take more Motrin. That was the theme the whole time. And so after 2 weeks of this, I went into the hospital and I stayed there for 2 weeks. And that's where I met my husband, Paul, my first husband. So I was on the rebound. Paul was younger than me. At the time, he was 19 and I was 22. And, that 3 years when you're that young is a big difference. So, we started getting together. He was very, very sweet to me. And, we didn't have that long of a relationship before we got married. And we were dating. We were hanging out at the pool together. I was told by the neurologist to give me a sheet of exercises, and he told me, get in the pool and do this. And I had taken a lot of pool classes when I was in college. So getting in the pool and doing pool exercises was a good thing for me, and it was very helpful to me. So we had about a 3-month engagement, and my mother flew out for the ceremony. We were married at the chapel at Lowry, and we went to Jocelyn's, and I bought my dress, and I bought my bridesmaid's dress, and I was working a night shift before that, so I had to go home, go to sleep for a couple hours, get up, get my hair done. And I had long hair then, so I had these little roses and these little buns around my head, like a little halo. And so that's, how the wedding went. And we went up to Glenwood Springs to spend our honeymoon together. And that was really nice. We drove around a little bit in a truck that he had borrowed. And we clicked. But two things there. We were trying to have a baby. And he had gotten wrapped up in this church that he went to with some friends of his from work. And it was a Pentecostal church. And I had been to a Lutheran church, and I had gotten the catechism and all that stuff in the Lutheran church. And Paul went to this other church, and they were convinced that the 75 of them at that church were going to go to heaven, and the rest of us were doomed, for all time to go to hell. So I couldn't buy into that narrow a belief system or that narrow a worldview. So I couldn't appreciate that. And so we went into counseling, and he insisted that we bring the pastor and his wife to our home, to talk to us about marriage counseling. So we liked each other, but he thought sex was just for procreation, and I was young, and I thought sex is a good thing. I want to have sex with my husband. So the only way to get him to have sex with me was if we were trying to have a baby. So we were trying for a while. Things weren't working out. Went to one of the residents that I worked with, and he did the semen analysis on my husband, and he called me and he said, "Kyle, he's shooting blanks." So Paul had a varicocele, which is like a varicose vein in the testicle. And he was only producing about 500,000 sperm. And a normal sperm count at that point in time was considered to be 20 to 60,000. And now it's gone down just because of our environment, all the pollutants, all the toxins in our system. Now the acceptable low range is around 10 million per cc. And his was very low. And with my back and hip hurting so badly, I had started seeing an osteopath who did osteopathic adjustments on me. I was being seen in the pain lab for a thermography study, which was measuring the temperature of my body in places where I had pain. And they would have you absolutely naked in front of the camera taking full body pictures to see where you heated up. So the pain clinic person, she finally hands me her card one day, and she says, "By the way, I'm also an acupuncturist, and I think I can help you." So she started treating me for hip pain. I was 22 years old at the time. And then I told her about my husband with his sperm count, and he had an operation for this. And the operation helped to an extent, but it didn't take care of the problem totally. And so it brought the count up to about 2 million. And he still had some morphology problems with the shape of the sperm not being correct. And those will not fertilize an egg. So she worked on him. She got his count up to 45 million. I got pregnant, and I ended up miscarrying. And I was, on the other hand, being worked up for infertility. And I had had a pregnancy that I had lost with Mark, with the fiance in college. And they had done a little DNC after that. I had had something called a hysterosalpingogram, which is a test where they shoot dye into the uterus, and it goes through the fallopian tubes. And you can see it fill and spill, is what they call it, where they watch the fallopian tubes fill up with the fluid, and it comes out of fallopian tubes. It's a pretty painful test, but it lets you know if there's anything inside the uterus or the fallopian tubes. Well, they saw a little bit of kind of fuzziness, which they thought were some adhesions or scar tissue in the uterus. But my tubes were open. Everything else looked fine there. So just after this miscarriage, I was scheduled for a procedure called a hysteroscopy, which is looking inside the uterus, and a lysis of adhesions, which meant that they would go through with an instrument inside of that hysteroscope and take out the adhesions microscopically while they've got their eye on the scope. And they've got the uterus filled with a fluid that they can see these lesions in, and they can cut them out. So I'm there as the patient. I have all this experience and knowledge in OBGYN procedures, etc. I'm consented by the doctor before I'm put to sleep for the hysteroscopic procedure with lysis of adhesions. I sign it. So I'm put under, and I wake up, and Dr. Karen Matthews, who Suzanne knows, she was a resident at the time, she said something about them doing a DNC, which was absolutely contraindicated. And I'm like, no, that's not right. That's not what they did. That's not what I consented to. And she said, yeah, it looks like, that's what we did, was we did a DNC. And I'm confused and just coming out of anesthesia and thinking, no, that can't be right. Well, my infertility problem was extremely worse after this. My uterus was full of glass-like adhesions. My tubes were blocked from this. My only choice was to do in vitro fertilization. So I ended up having 6 egg retrievals, 6 embryo transfers where they try and make your uterine lining, which is called the endometrium, they try and make it hospitable for a baby to grow in. And they're looking for a certain lining inside the uterus, and it has to be a certain thickness, and it has to have a certain appearance for it to be ready for a baby to land. So I never had that the stripe that they want to see in the uterus, except for when I went to the doctor that researched that out in California, and I happened to be in the middle of my cycle, and he saw that and gave me a picture from the ultrasound machine. So I ended up having 3 revisional surgeries to take out all the damage that this guy had done. And through the years, I have seen 5 different doctors who all wrote letters for me saying that this was malpractice. This was blatant malpractice. They didn't say, oh, it was a little mistake, or, oh, it wasn't actually the standard of care at the time. They said blatant malpractice everywhere. So when I had the hysteroscope at Fitzsimmons, I was diagnosed with endometriosis at the same time. And I am service-connected for endometriosis and the scarring in the uterus, which is called Asherman's syndrome. So I had a total of 6 pregnancies lost. And the last one, I was 41 years old. I was last with my fiance on New Year's weekend. I had my cycle. I had a very light bleeding, and then I didn't get my cycle. And I went ahead and I took a pregnancy test, and it was positive, and I didn't have any of the symptoms that I would have had with the other pregnancies. I started shaking. I had plane tickets to take my daughter back to China, where she was adopted from, and that was our first trip, and we were going with friends to help them adopt their 3rd child. I was shaking. I was scared to death. I knew something was wrong, and I was a Kaiser patient. So I was with one doctor who knew what she was doing. She was very competent. She sent me off for an ultrasound, and she left that day at the end of her shift. And some little resident came in, and she was the doctor on duty. And I was with an ultrasonographer who was 7 months pregnant and who was trying her best to find where the pregnancy was, and it was in the tube. And, she was apologizing because she knew how horrible it was to have somebody, with a pregnancy loss and the infertility history that I had. And here I am having to see her, almost ready to give birth. And so they did all these HCG levels, which is the pregnancy hormone. They're supposed to be doubling when you're every other day. They should double when you're early in the pregnancy. So I asked her for medication that would take care of it. And I didn't want to have to go through another laparoscopic procedure because I'd already had 6 of those. And so I asked her for a drug called methotrexate, which is a chemo drug, and it kills the placenta, basically, is what it does. And she said, "Oh, no, I'm not going to do an abortion on you. You don't know how far pregnant you are." And I said, "Yes, I do, because I remember when the last time I had intercourse was." So she didn't help me. And then I got a hold of another doctor who was very young and very ignorant and wasn't listening to me. And then I had called the OB-GYN clinic, and I spoke to a nurse. And immediately I got a call from the head nurse, and she said, "Dr. Barton wants to see you today at whatever time it was." And I walked in the door, and he said, "I think you have an ectopic pregnancy." And I was so frustrated. I just looked at him and I said, "Bingo." And I never would have said something like that, And so he called down to Denver and spoke to the reproductive endocrinologist, which is a fertility specialist. He called that person and talked with him about my case and what they should give me. And he wanted to give me a double dose of the methotrexate. So the nurse came back in, and she's drawing this stuff up under a hood, and it looks like antifreeze. And there's 10 cc's in each syringe, which is a huge dose. Most doses of any medication don't go over 2 or 3 cc's. And so it goes in the buttocks. And I was a little panicked. I really didn't want her to give me these injections because I had had nurses give me oil-based injections with all the in vitro attempts, and I had given myself some of those. So I said, "Do you mind watching me put these in myself?" And she's like, "Well, if you are brave enough to do it." So I actually shot myself up with those. And I ended up having to go in every other day and get my blood drawn. We were 2 weeks out from going to China. And I didn't know that I was going to feel like I had been hit by a Mack truck, but I felt horrible going to China. It was awful. The infertility, I didn't get that counted for me in terms of service connection for a long time, but I was severely depressed. I had anxiety. I remember going to a rating exam in Wyoming, and the doctor was supposed to have asked me all of these questions around the depression and actually even PTSD, which is in my records but isn't there as a service connection. I think they actually put dysthymia down as my service connection. But I had just miscarried less than a month before I saw this guy. And he just left my mental health status where it was previously. He didn't add to it at all. And he didn't listen to me.
And so this ectopic pregnancy, was that at Fitzsimmons?
No. I was a civilian.
Oh, okay. So
then.
This was after you got out?
Yes.
Okay.
But the damage was incurred.
The damage was done. Yeah.
While I was in the Army. Yes.
And so when did you get out of the Army? I
got out in 89, and then I was in the reserves for 2 years, 89 to 91. And in 1989, I divorced Paul, and I met Tim, my second husband. I met him at a Reiki party where I had actually started learning to do Reiki, and Paul was initiated in Reiki. And then Tim was initiated in Reiki. I was already a level 2 practitioner in Reiki, but that's where I met my second husband. So I actually got divorced. I went back to my maiden name, and I got remarried. So I had 3 different names that year in 1989.
And then you said something about your adoption. When did that
occur?
Right.
So the first adoption was my son, Ari. And Ari,
And what year
Well,
was that?
It was 1991.
Okay.
So my friend Wendy had opened an adoption agency, and she had a woman from Indonesia who had some very specific requests. She wanted to live with the adoptive parents and get to know them before she gave her baby away. She wanted to ensure that the baby had some exposure to Islam. And she also wanted to make sure that the child would go to college. So,
She didn't want much.
right. So we talked about it, and I really wanted to adopt this baby. And I knew that I had a daughter out there somewhere. And I knew that this baby was a son. But I knew that I was supposed to have this baby. And we talked, and then we met Wendy and her husband Mark for dinner, and she started talking about this lady again. And Tim, my now ex-husband, he and I were talking, and he said, I think we're meant to meet this lady. And we met her. She was going to school to get her master's here in Colorado, and she had a little apartment for herself, and was already being seen by a doctor in Denver. And she had made all these appointments when she was still in Indonesia. She'd made 5 appointments to have an abortion. She had gotten pregnant by another professor. She was a professor. And that professor was married and had 3 children already. And he, more than anything in the world, didn't want to get caught, because he was stupid and he shouldn't have been screwing around on his wife. And he did not want to be bested by his wife or his children. So we never met the birth father. I talked to him on the phone a couple of different times. And he said at one point he did want to meet Ari. And that was after Ari was already over 18. And I just said, I'll talk to him.
Later,
yeah, I said, I'll talk to him. And if he wants to meet you, I will give him your number. But anyway, he was a jerk. He the second time after that I talked to him, he was like, I don't know who you are, what you're wanting from me. And it was the same person, I could tell.
So
But-
Ari was your first one.
Right. So
And
at that
then-
point, I had gotten out of the Army. I spent an entire year working as a travel nurse because I didn't want all the responsibilities that came, all the politics, et cetera, that came with a real job in nursing. I just wanted to go nurse when I felt like it, go take care of people. And when I felt like taking off for a couple of days, I just didn't answer my phone. I had a good time, and I got to work at different hospitals. And then, when I felt like it was time to get a job, I got a job at Children's for a year, worked in the special care nursery, and I heard about Avista, this new hospital that was opening up north, and I went and interviewed there, and the hospital wasn't even completely built yet, and I was a charter employee at Avista, which was an Adventist hospital, and we had labor, delivery, recovery, postpartum, newborn nursery care there.
Wow.
So I did it all, and I was, a charter employee. I actually helped write a lot of the policies and procedures for the labor and delivery and for the newborn nursery.
And then how did you decide to get another child?
Well, okay, so with Ari, to go to his story first. So Wendy, the one who owned the adoption agency, she came with us. The first nurse was my friend Jill, and she checked Teddy in, the birth mother. So she checked her in, and then my friend Jan was on duty for the rest of the day. And they were really busy on OB that day. And Jim Richard was the doctor, and Jim and I had traded off delivering each other's babies, so we really knew each other. And Jim's office was not busy at all that day, and all his patients had canceled. So he came and hung out with us in the delivery room. And Teddy wanted an epidural, And the anesthetist tried like 7 times to get it in. It just couldn't get it in. And I was like, we're done with that. And so they called the anesthesiologist, and he came and got it in first time. And we were going to have to pay half of the expenses because the hospital would write off 50% for an employee. So the anesthesiologist said, who's paying for all this? And we said, we are. And he tears up the face sheet and he said, have a good delivery. And he hands it to me. So he didn't charge us at all for the epidural. And with Asian people, a lot of times they don't metabolize narcotics as we do. So they put an anesthetic and a narcotic in the epidural drips. So she was absorbing that narcotic and she just fell asleep for the rest of her labor. And we were having to wake her up to get her to push, which was kind of funny. And he came out with a compound presentation with his hand up by his face. And I always told him that he came out waving. He's a very social person and he knows everybody. And I remember when he was in middle school, I'd walk past a mother or talk to somebody and they'd say, oh, who's your kid? And I'd say, well, Ari Liston is my son. And they'd go, you're Ari's mom? So everybody treated him like he was a rock star when he was growing up. But I really had a problem in nursing with delivering all these, 13 to 17-year-old people, teenagers, they'd come in and they'd bring the class of whatever year that they belonged to, so the whole class would come in and they're sitting in the waiting room and the baby's father is like, hey, dude, that's my kid, and I thought, you're lucky if you're going to see a pack of Pampers for that kid coming from the dad. You're not going to see him anymore. That's over. He's done. He's, been Mr. Bravado, I'm the dad kind of thing. Your mother's going to be the one taking care of that baby. And so, they would deliver and, the mom's in there trying to take care of her daughter and the baby. And, by the next checkup, that's exactly what had happened. The mom's taken over the baby's care, et cetera. And then you would have a fetal demise, someone whose baby had died in the uterus, and you're trying to get her delivered. And that's the saddest thing that can ever happen in labor and delivery. And your other patient is delivering, and this is before the sex was revealed, before you would give birth. Sometimes you could choose to know it or not know it. And they would deliver this perfectly healthy baby. And you'd say, oh yeah, it's a boy. And they'd go, oh, another boy. So I really, as an infertile patient, that killed me inside, that internal turmoil. It was awful. I would have given anything to have a perfectly healthy baby. And here they are snubbing the fact that they've got a healthy baby. And here you are in the other room with someone who has to deliver a dead child and knows that. So I just shut down emotionally. And I had my veterans benefits. And I went and started talking to the vocational rehab staff. And they offered me medical school. And I didn't want medical school. And since I was 22 years old, I had been going to the acupuncturist. I found out acupuncture helped me with shoulder pain after a car accident. It helped me with chronic sinusitis. I actually had a miscarriage where the baby didn't have a heartbeat when it should have had a heartbeat. And it was still growing inside me and was up to 4 months, but no heartbeat, no baby. And I went and saw an acupuncturist, and he did a very strong electroacupuncture session on me, and I passed the tissue, had contractions, et cetera, and went into that. So I told them I wanted to go to acupuncture school. And they said, well, we don't know about acupuncture school and vocational rehab. And then finally they said, we found out somebody in California sent a veteran to acupuncture school. So they talked with the local acupuncture school, Colorado School of Traditional Chinese Medicine, and they said, well, we have to make sure that this is ADA compliant so that, a veteran in a wheelchair or has special needs can't move their hands as much as they, should be able to put the needles in. We have to accommodate every veteran who wants to go to acupuncture school. So they worked that out with the school for me. And so I was able to go to acupuncture school and become an acupuncturist.
And how far out of the service had you been at that time?
Well,
how many years?
I started school in 1993.
Okay.
So Ari was 2. And it was very hard. My ex-husband traveled for a living. He was a traveling salesman in the oil industry.
Mm-hmm.
And I was working night shifts as a nurse, still at Avista. And it was a tough thing because most people who go to acupuncture school absolutely cannot hold down a job. And my ex always did this spiritual one-upmanship where, we started studying Yogananda together, Paramahansa Yogananda. We studied that together as a form of spirituality that was kind of Christian Hindu together. But every month it seemed like he had a different spirituality that he was checking into. And I thought, why don't you just believe in God and, Jesus Christ and move on, stick with what you got. But he had to tamper in different things. And he was one of those husbands that, he had to sit and meditate for 4 hours at a time and wouldn't go outside and mow the lawn, because he was in a spiritual happy place. So
I'm assuming you graduated from acupuncture
Oh, yes.
school despite it.
I graduated with
Sounds
straight
like you
A's.
found your calling.
I graduated with a 4.0, which is also unheard of in acupuncture school. And then at the end of my first year, we had applied for adoption with Chinese Children Adoption International.
Okay.
So that was an 8-month process. So we had to submit all of our paperwork. We were called and even nagged by the agency. They were that good about saying, if you want to stay in your travel group, we have to have this documentation. We need it now. We need it faxed. So we would go to these meetings and we would get, our papers in order. And we had to travel in May to pick up our daughters. One couple picked up a son. And my baby was going to be 4 months when I got her.
So I was just going to ask you that.
So, and I kept dreaming about the baby.
Mm-hmm.
And I kept seeing her being carried away, and I would see the baby's profile. I never saw the baby's face, but I saw this Chinese nanny carrying her away. And when I got to China, we had a postage stamp size picture of her.
Wow.
And we had
That's
it blown
pretty
up
little.
to, maybe 2 by 3. And we had given it to Ari. And Ari wanted a little sister. He was very clear on that. He really wanted a sister. And Tim's sister took care of him while we were in China. So we got to go to China when it was still China. And, it was we were group number 8 from CCAI. We were the first group that the owners did not go to China with. And we took a social worker with us who was an absolute disaster. We had to make sure she was at meetings on time and that she was on the bus on time and that she caught the right flights with us, et cetera, et cetera. She was scatterbrained. But we got into China and we were sitting at the orphanage. They weren't ready to give us our babies yet. We were filling out forms saying that we would never mistreat the daughter. We would treat her like she was our own flesh and blood. We're going to take care of her. All these things. It was like writing sentences in school. And they put a picture of a baby on our forms. It wasn't the picture that they had sent us.
Interesting.
So I go up to the Chinese officials. I said, this isn't the baby. So they take the picture off and they put the other picture on and they said, this is your baby. So I sign everything. And the other couple, Rick and Heidi Myers, they got a picture of our baby. And their baby was 6 months old. So they told Tim and I that they had switched the babies. I went absolutely berserk. Was not prepared for that. That was like losing another baby. I was absolutely out of my mind. I did not sleep that night. I had taken Halcyon, which is a very strong sleeping pill. And I had only slept a couple hours on the plane to Hong Kong, and I didn't get any sleep between Hong Kong and China. Kunming is where we had adopted from. So I am at the hotel later that night. They had promised me that they would take us to the orphanage the next day, and that they were sure that I would see the baby and that I would bond with the baby and everything would be okay.
Even though it was a different baby.
Right.
Okay.
So this is the Chinese government telling me this. I am going crazy. I'm crying. I'm yelling at them. I'm angry with them. I am very upset. How could you do this? This is the most important thing in my mind.
Hardly wait to find out what happened.
Yeah. So, I am just out of my mind. I'm crying. I'm all over the place. My husband didn't apologize for me. He didn't try to speak for me. He didn't do anything. He just sat there like, okay, when is she going to quit screaming, crying? And, we're in a communist Chinese hotel, and I'm dealing with communist Chinese officials. And we finally get up to go to the 8th floor where our hotel room is. And he pulls the spiritual one-upmanship again. He says, maybe the universe is trying to tell us that this isn't the time to adopt a baby. I'll call United. We can catch a plane tomorrow morning and get out of here. Now, he is 20 years older than me. I realized that at the time he was 45 years old. Okay, that's a given. But our marriage was in so much trouble from about the time we got Ari until the time that we left for China, that was the game over button that he pressed. And I could hardly speak to him. So they took us to the orphanage the next day. And it was like a really bad trip to the Humane Society. They were handing me babies left and right. Here, you can have this baby. Here, you can have the Myers baby. And I'm like, I'm not taking their baby because you screwed up. I'm not even going to hold their baby. And you could have this baby, or this baby is only this many months old. You can pick this baby. You don't want that baby because his nose is bitten off. I remember that baby. You don't want this baby because he has a heart problem. And this is your baby. Well, my baby's face was all covered with yeast, and she had thrush on her tongue, her mouth, all over her face. And so it was difficult to kind of look through that and even see how she looked. And there was a nanny, Dayong, there, and she was the nicest person. And the cab driver looked just like this lady who taught us Qigong at our school one night. And I trusted her. And I trusted Thomas, who was our tour guide. And I trusted the one nanny, Dayong. And so I finally said, I'm taking the baby outside. So I take the baby and I'm in the courtyard with her and I'm looking at her. And she's trying to coo and smile and, contact. And she's making eye contact with me. And so the doctors from the compound, they come over. And in China, you want the baby's head covered. They bundle them with all these layers. They don't want the wind to come in because they believe that wind causes all evils or causes all diseases, that there's some kind of wind entering the person and disturbing their constitution and making them sick. So I didn't have a hat on her. And the doctors come out, and I understand enough Mandarin to know that they're telling me that she is going to get sick because of the wind, that I have to take her back inside. So I walk up the staircase to the baby room, and I'm outside with the baby. And they're saying, well, you know, you can come and pick up the baby tomorrow. And I'm like, no, I'm taking the baby with me. And they're arguing back and forth about this. And I said, no, I'm taking her back to the hotel.
At that time, did you determine it was the baby that you had looked at?
No, this goes on. So nurses and teachers are the two types of people, especially women in nursing and teaching. They don't bond with their babies right away because it's just another child. So they bond with, 30 to 40 people at a time in their classroom or on their ward as a pediatric nurse. But, they bond with all of them. So they're just as bonded with their own kid. And it's kind of this is just another baby. So, of course, I was taking care of her properly. So, the next day, the people who got their babies, they're all in a nice, pretty, outfit that somebody from the U.S. has donated, and they're in a pamper. And my baby was in a little, Santa red onesie with little white bands around her. And she's got rags wrapped around her for a diaper, and it's tied on with a piece of mesh. That's what they were giving her. And then they gave me a bottle of nystatin, which is for yeast. Mm-hmm. And that's probably the only bottle that they had in the whole orphanage. And they did tell me what her feeding schedule was and how much to give her and to mix it with rice cereal. And then we get back to the hotel. She's not taking the bottles that I got. I sent Tim out to get baby bottles. And I gave him the hotel card, which had the address in Chinese on it. Now, if I hadn't given him that, it would be just like National Lampoon, where he would be running laps still to this day around the circles trying to find a shop that sold baby bottles. So, and somebody wrote down baby bottles for him because he wouldn't have been able to walk into a market and buy those. So he went out. Annie was crying, so I showed her herself in the mirror. I laughed with her. I talked to her. I rubbed her back. I gave her toys. I did all these things that parents would try and quiet a baby with. I tried to cup feed her with the formula, see if she would take it that way. And what was going on and what I was really ignorant to was I was totally overstimulating a baby that had never had any stimulation at all. And she is crying and screaming and looking at me like, put me down. And so finally, we both fell asleep. And then Barbara, the social worker from hell, she had tried to make us stay in our room. She said, you're not to go anywhere. You're to order food to your room. You're to do this, 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 this. And she's trying to boss us around. And I'm like, you're not my effing mother. I already have a mom. I'm taking care of this baby. And I had probably 6 or 7 people show up to the hotel room and ask about the baby and wonder how the baby was doing. And one of them was this big, tall Chinese man. He was big around. And in northern China, the people sometimes have that stature, that they're big and tall and round. And so this big, huge guy comes to the door and he's saying baby, and he's, rocking his arms. He wants to see the baby. And I'm like, no. And he keeps gesturing and he's pointing to the crib. And I'm like, no, because I'm afraid that this guy's going to take the baby from me. Well, it turned out he was the notary. And when you're a notary in China, that's a big, important job. It's not like here, everybody's got this rubber stamp and they're a notary and you pay them $5 and you move on. So we all had cash. So everything that was done on the trip was all cash back then. We had to give $5,000 to the orphanage in cash. We had to give $500 to the notary in cash. We had 10 families. So, literally thousands of dollars handed, over the table to these folks just to adopt these children. And so even the Chinese guides, they took our passports away from us. We had copies of our passport, but we didn't have the passport. So, and when I was at the orphanage saying that I was taking the baby, they said, no, you're not supposed to get your baby till this date. Well, I had paperwork saying that I had adopted the baby 3 days before I landed in China. And that day we had gone to the official place to get the Chinese adoption paper. I had to get a license to adopt her. So I'm taking the license out of my purse and flashing it. Hey, this is my license. I think this baby is legally mine. So they couldn't refuse me to take the baby home. And the first thing I did when I got her back to the hotel was stripped her and went into the bathtub with her. Well, I don't think she was ever immersed in bath water. I think she had, sponge baths. Mm-hmm. And, I'd get her hair wet, I would wash her hair, I'd dry her off, I put her in, decent clothes that I brought for her and put her in a diaper that I brought for her. But we went down to dinner, and this Malaysian guy was there, and he was speaking English to us. And he told us about all the door knock deliveries that he got. So he and his wife took in, I think it was 11 children, and someone would abandon a baby on his doorstep. And so it was around winter solstice. And he said somebody put a baby there, and he and his wife were feeding the baby and changing the baby all night. And they woke up, the next morning, and the baby was a very dark baby. He wasn't even sure that the baby was Chinese or Malay. And they just dropped the baby off. And he said, of course we raised her like we've raised all the other babies. And he said, this will be your baby. Don't worry about it. So when we got back to the U.S., of course, being a nurse, I'm taking good care of this baby, but we haven't really bonded yet. So one night I came home from school, and school would get out at 10 o'clock at night, sometimes 9 or 10. I'd drive back from York and Colfax up to Erie, where we lived. And I'd get there, and I'd give her her last bottle. So I'm giving her a bottle. She turns her face to the side. And then she turns back and looks at me. And then she turns to the side again. And it's the same profile as the baby in the dreams. Mm-hmm. And she looked at me. And I'm like, you're the baby in the dreams. And I told her that. And suddenly we're looking into each other's eyes for about 45 minutes. And babies that old do not have a 45-minute window that they can interact at that level with you. And her first name is Anastasia, which means the resurrected. And I knew that, but I didn't really know that. So a few days later, I'm holding her. I'm downstairs in our bedroom, and I'm holding her and playing with her. And I'm saying her name to her. And she's 6 months old. And she looks at me and she says, Bagastasia, just like that. 6 months old, do not talk. She didn't say Anastasia, she said Bagastasia, but she pronounced each syllable perfectly. And I knew, that was when I knew that was my child.
So how old was she when you brought her home? Did you
4 months.
Determine that? So it took a couple of months.
She was 4 months old. Yeah, it took 2 months, but I knew that's my child. That is my daughter.
So is that all of your children, or do you have more?
I had one more.
Okay.
I had a son named John. Mm-hmm. We called him John. His full name was Ahmed Sharif Zahidi. He was born in Afghanistan and was the son of a dentist, the only dentist in his town of Ghazni, Afghanistan. And his family had some wealth. And his father told him two things. English will save your life. And if you're ever in trouble, go to the UN. And the father kept getting death threats. He was working for a Christian NGO in Pakistan as a dentist, and then he would come home. So they were constantly getting death threats in the mail. And the father was kidnapped when John was 12. And when he was older, he was accused of sleeping with a girl, and the girl's family was planning to kill him, and the girl's sister came to school and told him that. And so his mother gave him all the cash she had and a couple of silver rings, sent him by car to be with his uncle on her side of the family and stay until he got a passport and could cross into Pakistan. Well, because of that accusation that he slept with a girl, the uncle beat the ever-loving crap out of him. So his passport photo was all bruised and battered, because he beat his face, etc. So he gets into Pakistan and he realizes that there's nothing there for him. And there's a map, and he points to countries that are taking Afghan refugees, and he lands on Malaysia. And so he buys a one-way ticket to Malaysia. He gets there, he hears someone speaking in one of his dialects, and at that point he speaks fluently 7 languages. So he hears his dialect, and he starts talking to these men and asking where he can work, where he can live, etc. And they said, "Oh, you can come live with us." Well, he became a house slave. It was human trafficking. And he finally convinced them that if he could go out and buy vegetables and meat fresh, that he can cook better food for them. So they give him a house key. He goes and makes a copy. He gets a locksmith. Then he takes some of the very small amount of money that he has that they give him for food, and he goes to the UN. And he ultimately convinces the UN that he's in danger, and he's transferred to an orphanage. Well, orphans from Afghanistan there cannot go to school. It's illegal for them to go to school. And they really can't leave the compound that they're on if they're in an orphanage. So he hung around with the orphanage director.
And how old is he at that point?
He was 15.
Okay.
Yeah. So he hung out with the director, and sometimes he didn't like the food that the cook would make. So he would cook the food. He would do the laundry, and his laundry had to be very clean. So he would say extra wash or rinse, double spin was his thing. So one day, this retired Chinese Malay English teacher pulls up in her car, gets out, and approaches John, and he greets her in English. And she says, "Who do I talk to teach older children English? Because I'm done teaching the little children." And so he introduces her to the orphanage director. And she starts teaching the older kids. John is patiently writing down everything she says and learning. Then scabies breaks out. So he goes, and she lets a one-room apartment. She boils his clothing, puts scabies medication on him, and takes care of that for him. She returns him to the orphanage, and she decides that's no place for him to live. So she convinces the UN to let him live with her. So she becomes his first foster mother. And he can stay up till the age of 21 in foster care here. So he was transferred to the US as an unaccompanied minor refugee. And he had all the high school he needed. She had enrolled him under a pseudonym as Jonathan Tay, her last name. And he completed all of his high school in 2 years instead of 4. And he got here, and they wanted him to do a semester of high school. He ended up graduating valedictorian of his class. People didn't even know who he was. And he had given a speech at Project PAVE, which is a project in the cycle of violence. They're a big, huge organization here in Denver.
Wow.
Yes. And he had also given essentially the same speech to the graduating foster youth in Denver. And he had people laughing and crying at his speech each time. And he was asked to come back to both foster youth and the Project PAVE every single year.
Wow.
But
so
John
how
and
did
I
you end up
bonded.
meeting?
Well, one of my clients who was an infertility patient, she talked to me about Lutheran Family Services and their program for refugees and also their program for unaccompanied minor refugees. So that's how I ended up meeting him.
Wow.
So John passed away last year due to alcohol intoxication and
how old was he?
possibly passive suicide. He was 31 years old.
31.
Yeah.
So you
And
had him
still-
for what, 10 years?
No. Almost 14.
Okay.
Yeah.
It was very sad. Well, I'm sorry.
Yeah. Thank you. And my VA family really supported me.
Yeah.
But I do want to cover a couple of other things. After becoming an acupuncturist, I really went full circle with respect to the infertility. I started helping other couples with their infertility. I started actually assisting with in vitro embryo transfers with the acupuncture. There are studies saying that it actually improves uterine arterial blood flow, and it improves embryo transfer statistics, live birth rates, and actually improves the health of the babies and prevents early miscarriage or early births, premature births. So Rich Perico, the very high-risk doctor at Press St. Luke's, was actually allowing his pregnant patients to come and see me and a few other acupuncturists he felt comfortable with seeing his patients for what we call high-order pregnancies, which means triplets or more.
Wow.
Right. And I had to support patients who would go in and have 2 embryos transferred, and they would both split and become 4, which were identical twins. And they had to go even out of this state to have selective abortions. So these are people who have tried their hardest, invested their all in trying to get pregnant with just one precious baby.
Yeah.
And all of a sudden, they're pregnant with 4 babies, and 2 of those babies are going to die. And 2 of those babies are going to be overfed from the placenta that they are sharing, and they're going to be sick too. And if they want to save this pregnancy and have 2 babies, they have to selectively abort 2 babies. So they've never even considered abortion until they walk into the doctor's office. The doctor counsels them and says, this is what we have to do today. They get about 30 minutes to make a decision and do it. I've counseled those people. I have introduced people to each other who've had to go through that. I've helped people adopt children. I've helped people find jobs where their infertility coverage would be provided for free under their care. And I was the first woman to be in the women's program at the old VA hospital here in Colorado. I was the first infertility patient to be treated here. Now, they didn't cover in vitro fertilization when I was going through the procedure myself, but they now cover it. And when fighting for my service-connected disabilities, I actually even slipped them a bill one time to pay for my adoptions, which they didn't do. But one time, I was going to see an uncle of mine who was dying. And it was after my busiest day in my practice. And I was going on Midway Airlines that traveled from Denver to North Carolina. And I had my ticket out. I was ready to go. And some guy in front of me was fumbling for his ticket. And this was way before the TSA stuff. And so the guy motions me forward to come on and tear my ticket. And so he says, you have a very nice flight tonight. And I was already starting down the ramp, and I looked at him and I said, thank you. And I see his name on his name tag. And it says Ed Lundblad. And I'm dazed walking the rest of the way down the ramp. And I get on the plane and I look at the flight attendant and I said, a guy there, his name tag says Ed Lundblad. And I said, is that Dr. Ed Lundblad? And she goes, what? And I said, it said Ed Lundblad. She said, yeah, that's Ed. And I said, could you check if you have time? And she said, oh, yeah. So she comes back halfway into the flight and she said, yeah, I couldn't call him at the podium, but I called the desk and they said he's some retired Army dude.
And you knew him.
Oh, yeah. So I came back on Midway Airlines a few days later. I am on a hunt. I am on a mission.
And so tell us why.
Okay. All right. They could not get a hold of him. My doctor, Bill Schoolcraft, wanted to speak to him about all the damage he had done to me. He was my surgeon. Dr. Schoolcraft wanted to find out why in the hell he butchered me. So I decide, okay, both gates are closed to Midway Airlines. There's nobody there. So I think, and I go, the lost baggage room. And I go downstairs, I get my bag, and I walk into the lost baggage room. And here he is assisting another passenger, and that's him. And I walk up to him, and he says, can I help you? And I nod. And he says, you're Kyle. And I said, yes. And he said, can I help you? And I said, I think you can. And he says, well, you know, I retired and I tried to do a little IVF with a couple of clinics, but, you know, I get flight benefits here and my wife has family back in North Carolina. And I thought, you're a retired freaking colonel. You get free MAC flights. You can get on a MAC plane and get anywhere in the world you want to go for $12. I know that. And I'm thinking, you know, you make enough money as a retired colonel. You can pay for your own plane ticket, for God's sake. So then he tells me, oh, they're training me to be in management. I'm like, no, that's good. And he said, are you still a nurse? And I said, well, yeah, but I'm an acupuncturist now. And he said, did you ever have children? And I said, I have 2. I almost told him I adopted 2. But I was not going to give him the satisfaction of that. So I just said, I have 2 children. But I had the satisfaction of knowing that he went from this elevated doctor, surgeon status to this peon working in the lost baggage room for Midway Airlines.
So he never knew what really happened.
He never knew. So the next day, the woman who had helped me, she was an attorney, and we tried to sue the Army, but we were blocked in circuit court by something called the Ferries Doctrine, which means that you cannot, as a soldier, you cannot sue the military as a soldier. They will not pay you because of this Ferries case. But you can actually sue the VA, but I didn't do that. So we were blocked. And Suzanne was also her name. She became a judge, and she was talking to one of the people that she worked with. She said she was talking to him the day before, and she said, I wonder whatever happened to that doctor. And I said, well, guess what, Suzanne? I called you today to tell you a story. And she said, you know, there's burgers to be flipped. There's garbage cans to empty. You know.
Wow.
She just,
so it came
she
all the way
delighted
back
in
around.
that story. It did. So, and then you wanted to know about Reiki. So the Reiki, my uncle had taken a course in North Carolina from a woman named Viola Ebert, and I had had a stress fracture in my left foot that wasn't healing. It was right before I was joining the Army. So David, my uncle, held my foot after his first 2 Reiki transfers. So Reiki, you have to get a transfer of energy directly from the master. So he's holding my foot, And I feel every sensation that one could feel with Reiki. I feel like hot water, I feel electrical, I feel tingling, I feel warmth, I feel cold, all these different sensations. So he holds it for 2 hours. I literally got up the next morning and was able to walk without any pain in my foot. Within 2 weeks, I'm practicing running.
Because you're going
Because I'm going into the Army and I have to be able to run.
Have to run.
I had to run at least 5 miles. So when I got to Colorado, I was actively searching out Reiki practitioners. And I found these 2 ladies in Evergreen, Trudy and Annalise. And I go up there and I get a few Reiki treatments from them, and it helped. And they said, well, let's introduce you to Timothy. So they introduced me to Timothy, and they said, yeah, Viola Ebert was our teacher, and she's coming, and she's going to do a Reiki class. And they said, but Timothy has these Reiki meetings every week at his apartment, and we do Reiki treatments on each other. And then, everybody gets treated, we share food, and then we go home, and everybody sleeps really well after these treatments. So I meet Timothy McNamara, and I go to Timothy's house, and we go to the Reiki class. I get Reiki 1, and then 6 months later, I'm trained in Reiki 2. And Trudy ends up having a 30-year relationship with Timothy. And Timothy does all these things on the side, and one of his side hustles used to be house cleaning. So I had some medical issues, and I had a seizure disorder diagnosed about 4 years ago. And my kids called Timothy and said, can you please help Mom with house cleaning and, doing whatever you can to help her and take care of her and watch her for seizures. So he says, okay. So he becomes my housekeeper. And Trudy's family, one of her sons, literally, she was getting dementia, literally pulls her away from Timothy. They didn't ever want to be apart. They never married, which was not a good thing because the son had more rights than he did. I never thought he was going to get over losing her. It never crossed my mind. But a few months back, he confessed to me that he really wanted to be with me. And he had felt that way for a long time.
Wow.
I didn't even believe he was being serious, but he was. And we've been together. So I now finally have a very wonderful, nourishing love life that I didn't have before, that I've been waiting for my whole life.
That's wonderful.
I do. Yeah. And, I had brought my first husband in. We did Reiki. One time he had a sunburn on his back. We put our hands on him. And after, we took our hands off, he had white imprints of hands on his back, and that lasted. And then we had this cat that had feline leukemia. We did Reiki on her, and she went into being a carrier, and we kept going with the Reiki, and she was freed from the leukemia. And then one of the women, a visiting nurse friend of ours, did Reiki on her and shrunk a pancreatic tumor. She was given 3 months to live. She lived another 15 years and became a Reiki master. So that was a really interesting part of my life, informative part of my life. I'm actually trained as a Reiki master now.
That's great. So did any of your military service have such a big impact on you as these things that you're telling me now? Because these acupuncture, Reiki, adopting children, those were very big moments of your life and finding the relationship. Yeah. What about the military? Any lasting memories from there?
There's one really good one. So I was on my 2-week drill in Washington State when Iraq invaded Kuwait. And my second husband and I, we weren't married. We had just bought a house together. And when I was at that hospital, I think it was Madigan, is that right? It's an Army hospital in Washington State. It was this one level, all these old World War II barracks, and it was totally covered in some sort of, can't remember what organism, but a staph infection was all over. Aspergillus was here at Fitzsimmons, but the staph was everywhere there. So I never even sat down during that 2-week drill. But we saw everybody getting orders cut to go places. And my 2 colonels, they came to me and they said, well, you just bought a house with this guy. And they said, if you want him to have rights to the house and to access your pay, if we get deployed, you're going to have to go over. And, he's going to have to be able to access your pay and be your dependent. And I'm like, okay. So we ended up with a military shotgun wedding. And then a year later, we adopted Ari. And I feel like mothers have no place to be in the Army, especially with the war going on.
Yeah.
So there is a discharge option for women who are pregnant and delivering a baby to get out of the Army. There is no regulation for women who adopt a baby to get out of the Army. So I actually hired an attorney to negotiate this with me. And so I got exempted from going to some of the drills. And the colonel who was over us, she called me in one day and she said, I need for you to come down and we need to have a little chat. And so she said, you can wear your civilian clothes. You don't have to dress in your uniform. And I said, ma'am, would it be okay if I brought the baby? And she said, yes. And so I got on this Mexican flowered sundress that I had bought on one of the Mexico trips from being in San Antonio. And I had this blue and red baby carrier. I had my hair down, and you can see what my hair down looks like. So I had that long hair at that time. I wore my Birkenstocks, and I had a diaper bag with a peace sign on it. And I go down there to meet the colonel, and she said, looks like you are done with being in the military. And she said, have a seat. I said, okay, yes, ma'am. And so she pulls out her photo album. And she says, you're going to have to see my grandchildren's pictures. So we looked through the picture book, and I see her grandchildren. And she said, I'm signing your discharge today for you. And I said,
so
thank
that's
you, ma'am.
nice. That's
So I did end up with 2 different jobs at VA hospitals. And the best job I ever had in my life was working at the Asheville, North Carolina, Charles George VA Medical Center as the nurse acupuncturist. And I very much enjoyed helping the veterans, and especially helping them get service dogs, helping them with their service connections, which a lot of them didn't even know about, and welcoming back our Vietnam veterans properly, the way that they were never treated when they came home from war, and just giving them the dignity and respect that they all deserved.
That's a big thing for them.
And I had 1 POW patient.
Wow.
Yeah.
So what do you wish more people, civilians, knew about veterans or military life, or both?
I wish this country would mandate a 1 to 2 year tour for everybody, just like the Swiss Army does. Prepare them, give them what they would need if they do have a war that they're called up for, and just make sure that everybody is able to do that. But I really enjoyed my time in the Army. I hated my last CO when I was on active duty.
There's
We
always
had
one.
we had 3 first lieutenants promotable. They all went on levy. They went to Korea. 1 had a new baby. 1 had 3 children. 1 was single, but they were all on unaccompanied tours to get away from that captain. She was that toxic. She forgot to give premature delivery patients their medication. She was the one who ended up being responsible for premature deliveries, and that was bad.
So what message would you like to leave for future generations who may see this interview?
I would
know you
like
have
for
one.
them, yes, I would like for them to support our veterans, our active duty military. I would like to see them more involved in sending care packages to those who are deployed overseas. I'd like for them to send them letters of appreciation and praise, and just do good deeds for our soldiers, our troops on the ground. And when they come back from deployment, I would like for them to be able to access mental health care a lot easier. than it has been. I'd like for the process of going through transition back into civilian life to be more accessible and smoother for them. I really think, especially with this endless 20 some years worth of war that we've been in for now, it needs to stop. And we need to not make war on every other country in the world. And we need to stop being the military police for every other country. And I'm afraid that we're going to see a lot more war pretty soon, and it's not going to be good. Yeah, I have a lot of fear and hesitation about that.
Is there anything else you'd like to add that we haven't already covered? Anything you can think of? It can be a funny story, it can be a sentimental story, or just something you feel we left out.
I don't know. Do you know any of my stories that I should share?
Maybe your journey becoming a volunteer at the VA.
Oh,
that's a
yeah. I just, after working at the Asheville VA, I just really miss being around veterans, and I just wanted the opportunity to do something for helping them. I love being a volunteer because we do not get pulled into the politics of the VA. The VA is currently on a hiring freeze, which is very sad. We need all the support, all the help, all the employment opportunities that we can get for people to come aboard and really be a wholly integrated Veterans Administration hospital again. We've lost too many doctors, too many mental health providers here, and we need to replace them. We need to staff our floors adequately. We need for patients who are staying in the hospital to come out of here saying this was the best experience I've ever had. They took fantastic care of me. It was phenomenal. We had musicians in our room. We had the facility dog come by and let us give her a treat. We had this, we had that. The food was awesome. The nursing service was out of this world, and I really valued the doctors who treated me. I want them to feel that way. I don't want them to feel the way that I felt coming out of the Army hospital, that I was butchered, that I was wrongfully treated, that I went out with chronic problems after that I had to have corrected.
Your entire life.
It did affect my entire life. And I was depressed, and there were times that I was not available for my children emotionally. And I regret that.
Wow.
And my daughter is pregnant with my granddaughter now.
That's wonderful.
Which is wonderful.
Wonderful.
And I hope that I can be a better grandma than I was a mother.
Well, thank you so much, Kyle.
You're welcome.
It was wonderful to interview you.
Thank you.
And to know you as a friend and volunteer with you. So thank you for your service.
Thank you. Love you.
Love you too.
Thank you.